So tell me about health information exchange. What are you working on right now?
Really, we've been involved in one of the most massive changes in healthcare, which is bringing healthcare into the modern age by making digital information available to both doctors, hospitals, and patients. Electronic health record adoption has grown 400 times since 2008 among hospitals. We've had huge acceleration of adoption, and a big part of that is making sure that once the information is digital, that you can actually share it to improve patient care, and that patients can get their own copy to keep, to use, and to share with other people.
And what sort of response have you seen from patients?
I think patients are really ready and are asking for a different role in healthcare, one that's a partnership where they can help set the goals and they can be working in collaboration side by side with the provider. Different skills, different roles, but that's what they want. And a big part of that is being able to do things like get your health record, check it for errors, let your doctor know if something's wrong, be able to manage your own medications using your information, or maybe even to aggregate your information so when you show up at a doctor's office, you're never left without knowing what your last lab test was.
I mean, it seems very natural to me that patients should have access to their own health data. Why has it taken so long for this to take place?
It's just now that we have the digital tools to be able to do this. A big part of HIPAA, the privacy law, has always been that the singular right that patients have is a right to their own data. But now that we have electronic ways to do that, it's so much easier. And they just clarified actually this week that your rights to your data extends to your electronic data, that if you want to get a copy in the form and format you want and you want that sent to you, that's also something you can do with all your providers and hospitals.
I see. So this can even help benefit for continuity of care. If a patient goes to several different providers, they'll all be able to have access to this patient's clinical history.
Correct.
Great,
Yeah.
great. And this is a part of the Meaningful Use Act you were mentioning?
Yes. The first down payment for health reform was the Recovery Act. The Recovery Act put into place incentives for doctors and hospitals to adopt and meaningfully use health records. Now remember, this wasn't just to go buy a new system. It was saying, actually, here's how we want you to use the system to improve patient care. We want you to e-prescribe. We want you to share information with patients. We want you to report your quality outcomes. And paired with those requirements was a certification system to be sure every EHR that a doc was using could actually perform those capabilities. So we've both moved the market to a much more functioning system while we've really accelerated adoption. And these services are really helping the same doctors and providers that are trying to deliver care under medical homes or accountable care organizations have the tools they need to improve care.
How has the electronic health record rollout been?
Well, it's a big change for everybody, and you've probably been in hospitals that are doing this. It takes a lot of effort, and there's often a period in time where you feel like, oh gosh, things are never going to get any better. But like everything, it's a process where we're starting to see that initial implementation lift was hard. Now people are actually getting to use their systems to deliver better care, and that's incredibly exciting. But the numbers speak for themselves. 85% of hospitals and 50% of the providers that are eligible are participating in the program. So that's amazing for all of us.
And switching gears a little bit, what have you come to MedX hoping to find, and have you found it?
This is one of the only gatherings where innovation leaders from the provider space, from the tech space, and the patient space come together. And the part I was particularly interested in learning more about was patients that are really at the cutting edge of trying to improve care for themselves. So I met one patient, for instance, that's trying to help create a collaborative community to better the care of children with cystic fibrosis. Another woman who's trying to donate her cancer genomic data for research. Another person who's trying to share his data from his cardiac device and track that data over time. So we often think of patients as the ones who just need to tell the stories about what's wrong, but they also need to tell us the stories about how to innovate to improve care.